Hi, it's Allie and Willow. I was just reading an article about a woman who was misdiagnosed and ended up suffering for decades with a disorder. And so the article was kind of bringing awareness to why it may be important to seek care with a specialist, a mental health provider. One, to make sure that you have the right diagnosis, the right treatment plan, but also an ongoing relationship with a provider who can be assessing your symptoms over time. So part of why you want to see a specialist is kind of inherent in the word specialist. This is what we specialize in. This is what we went to school for. All of our classes were geared towards mental health. All of our continuing education to remain being board certified is geared towards mental health. And we spend all day doing this. The second thing is time. So a mental health provider is going to spend longer than a generalist, like a PCP or an internist, even a OB-GYN, talking to you about your symptoms, treatment options, and monitoring your symptoms over time. So it's not just that time and that initial appointment. With us, it's 90 minutes, or the follow-up appointments, which are 30 minutes. It's also the time throughout the relationship, getting to know you, monitoring your symptoms over time, seeing you through different phases of your life. There's a saying in psychology and psychiatry that it's the relationship that heals. And so a huge part of your outcomes is your relationship with your provider. The last thing I wanted to talk about is how it's along the lines of misdiagnosis, but it's also the overdiagnosis. So oftentimes I see people receiving diagnoses and labels, and I'm meeting with them and I'm saying, hey, I think this is, maybe even a normal reaction to a very abnormal circumstance or situation. I don't know if this is necessarily a disorder. We don't want to pathologize things that are adaptive and protective. At the same time, we don't want to underdiagnose when people are really struggling. And that's why I think it's important to do your homework, know who you're seeing, ask them what their values are, what's their approach to diagnosing and prescribing, how they work with a client, if it's a collaborative approach where they remain curious over time, or if they are going to kind of pigeonhole you into one little box and then maybe fail to see some of the other things that are going on. And if you don't know where to start, give us a call. I am happy to answer your questions about, hey, is this the right time to be seeing a specialist, or should I be doing anything else? We're here to support women, and we mean that.